Jonathan Ashworth to ask his urgent question of Secretary of State for Health. Jonathan Ashworth.
Thank you, Mr Speaker. He asked the Secretary of State to update the House on its response to coronavirus.
Secretary of State.
Thank you very much, Mr Speaker. Mr Speaker, coronavirus exists only to spread. And yesterday, the World Health Organization once again announced a record number of cases globally. France and Spain have both reported daily figures of over 10,000 positive cases and increasing hospitalisations. Here in the UK, we saw yesterday around 2,600 new cases, and last week, medical advisors advised R is above 1. Mr Speaker, the epidemic is growing. There are signs that the number of cases in care homes and the number of hospitalisations is starting to rise again. So last week, we acted quickly, putting in place new measures, the Rule of Six, which came into force yesterday. We do not do this lightly, but the cost of doing nothing is much greater. Mr Speaker, testing also has a vital part to play. Everyone in this House knows that we're doing more testing per head of population than almost any other major nation. And I can update the House that we have now carried out over 20 million tests for coronavirus in this country. As we expand capacity further, we're working round the clock to make sure everyone who needs a test can get a test. The vast majority of people who use our testing service get a test that is close to home. And the average distance travelled to a test site is now just 5.8 miles, down from 6.4 miles last week. But the whole House knows that there are operational challenges, and we're working hard to fix them. We've seen a sharp rise in people coming forward for a test, including those who are not eligible. And Mr Speaker, throughout this pandemic, we have prioritised testing according to need. Over the summer, when demand was low, we were able to meet all requirements for testing, whether priorities or not. But as demand has risen, so we're having to prioritise once again. And I do not shirk from decisions about prioritisation. They're not always comfortable, but they are important. The top priority is and always has been acute clinical care. The next priority is social care, where we're now sending over 100,000 tests a day, because we've all seen the risks this virus poses in care homes. We'll set out in full an updated prioritisation, and I do not rule out further steps to make sure our tests are used according to those priorities. It is a choice that we must make. Finally, Mr Speaker, to defeat this virus in the long term needs effective vaccines and treatments. I'm delighted to say that over the weekend, the trial of the Oxford vaccine restarted, and I can tell the House that we will now be trialling a promising new antibody treatment on coronavirus patients in the UK. Mr Speaker, the challenges are serious. We must work to overcome, optimistic in the face even of these huge challenges, to keep this deadly virus under control.
Shadow Secretary of State Jonathan Ashworth.
I'm grateful for advance sight of his answer. That was decent of the Secretary of State. But yesterday, LBC revealed there were no tests available in COVID hotspots, including Rochdale, Pendle and Bradford. Over the weekend in Bolton, where infections are highest in the country, a mobile testing centre failed to turn up. Meanwhile, in Bury, hundreds queued for 5 hours for a test. In Walsall, a father with his sick child travelled 76 miles to an appointment in Wales, only to find on arrival that tests had run out. Increasing numbers of teachers and pupils are not in school. In hospitals, operations are cancelled, while NHS staff are stuck in limbo, waiting for tests. And he blames increased demand. But when tracing consistently fails to reach 80% of contacts, when less than 20% of those with symptoms self-isolate properly and there is a lack of financial security, infections rise. When schools reopen and people return to workplaces and social distancing becomes harder, infections rise. So extra demand on the system was inevitable. So why didn't he use the summer to significantly expand NHS lab capacity and fix contact tracing? And just as demand is increasing, the ability to process tests is diminishing. Postgrad students working in the Lighthouse labs are returning to university. So why did he not plan for these inevitable staff shortages in the Lighthouse labs? These commercial Pillar 2 labs, the Sunday Times revealed at the weekend, have a huge backlog of 185,000 tests. Thursday's data revealed that 65,709 test results were not returned by the end of the week. Care home residents now wait an average of 83 hours for their result. The Prime Minister promised us a 24-hour turnaround for results. So what is going on? And what is the current backlog? And what is the time frame for clearing it? We were promised a world-beating system, Mr. Speaker. So why are we sending tests to Germany and Italy for processing? But most importantly, people want to know when they will get a test and when this mess will be fixed. Yeah. Today, there will be thousands of ill people trying to book a test only to be told none are available. So when will people be able to book a test online again, or has the online booking system been deliberately disabled? When will ill people no longer have to travel hundreds of miles for a test that should be available on their doorstep? When will pupils and teachers out of school get access to testing so they can get back to school? And when will NHS staff access regular testing so they can focus on their patients, not be sat at home? Mr. Speaker, we are at a perilous moment. Imperial College estimates the virus is doubling every 7 to 8 days. We all want to avoid further restrictions or another national lockdown. But when testing breaks down, contact tracing breaks down, and the growth of the virus cannot be tracked. The Prime Minister promised us whack-a-mole, but instead his mallet is broken. The Secretary of State is losing control of this virus. He needs to fix testing now.
Yeah. Secretary of State.
Well, Mr. Speaker, the good news in responding to that is that capacity for testing is at a record high, and he raised the issue about testing in the top 10 local authorities. Well, I've got the figures here, Mr. Speaker. We processed yesterday 9,278 tests just in the Pillar 2, so outside of the NHS testing capacity, in just those top 10 local authority areas. Just yesterday, we processed 1,428 tests in his own local authority area. So the good news is that the capacity is at record levels and that record numbers of people are able to get tests. Now, I don't deny that it is an enormous challenge. And when you have a free service, it's inevitable that demand rises. The challenge is to make sure that we prioritise the tests we have as a nation to those who most need it. And that's what I set out in my answer. He asked about the backlog. The backlog is actually falling and is less than 1 day's test processing capacity. And he also asked about being able to have testing capacity so that we can re-enable the economy and we can get things going. And as he well knows, there is a huge effort to expand using the next generation of technologies, the tests that we need to deliver to reopen the parts of the economy. And we will deliver on that. So we'll deliver on the challenges of today. I don't deny those challenges, but what I do is face the facts to deliver on those challenges rather than simply complaining. And what he should do is welcome the record capacity and the contact tracing that is playing its part in responding to this virus.
Let's come to the chair of the Select Committee, Jeremy.
Thank you, Mr. Speaker. A week ago today, the Secretary of State told the Health Select Committee that he expected to have this problem solved in 2 weeks. Since then, in my constituency, I have had 2 Farnham residents sent to Bristol for their tests, a councillor sent to the Isle of Wight for her test, and a teacher who tested positive who had to wait a week for her results. So is the Secretary of State, given the efforts that his department is making, still confident that in a week's time we will have this problem solved?
Well, I think that we will be able to solve this problem in a matter of weeks. And in his own constituency yesterday, 194 people got their tests. So we are managing to deliver record capacity, but as he well knows, demand is also high, and the response to that is to make sure we have prioritisation so the people who most need it can get the tests that they need.
Let's head up to Central Ayrshire with Dr. Philippa Whitford, the SNP spokesperson. Dr. Whitford.
Thank you very much, Mr. Speaker. With COVID cases doubling every week, it's clear that laboratory capacity for diagnostic testing is not keeping pace with demand, and this is leading to testing slots being cut. For example, only 70 COVID cases were reported for Scotland, yet 267 were reported today, many from tests carried out over the weekend. With a reported backlog of 185,000 tests, is he not concerned that results will not be received quickly enough to allow timely contact tracing, and that the delay in data means new outbreaks won't be identified until they're out of control? Last week, the Secretary of State appeared to accept that additional NHS funding could allow hospital laboratories across the UK to rapidly increase their testing capacity. So can he confirm if he plans such an approach and on what timescale?
Secretary of State.
Yes, I think that it is important that we expand the NHS labs and that we work across the whole of the UK to get the testing capacity that's needed. For instance, in Scotland, when there was a surge in demand for tests last month, we diverted more of the UK capacity to support people in Scotland, and we currently deliver more tests per head of population in Scotland than in the UK as a whole. So I think to the tone of the Honourable Lady's question, absolutely it's necessary to work together across party lines between the Scottish devolved government and the UK government to make sure that we get the support to the people of Scotland as to every other part of this country.
Thank you very much, Mr. Speaker. Can I ask the Secretary of State about the rule of six? Many of my constituents are struggling to understand why they can play five-a-side football, but two connected families of five each cannot meet. Can I ask the Secretary of State whether he will look at flexibility when local rates permit, and also excluding under-12s? Christmas is just round the corner. I know he has to think of the health of the nation, but I really would urge some flexibility on the part of the government.
Well, of course, I do worry first and foremost of the health of the nation, and we need a rule that is super simple. Children do transmit this virus, and we've made the decision to keep the rule very simple and as simple as possible, considering all of those risks. So I understand where my honourable friend's coming from, and what I would say to him is that we do take an approach that's different in different areas according to the extent of cases locally, and that's a very important part of one of the tools in our armoury.
Thank you, Mr. Speaker. Like many others, I've been inundated with emails from doctors, teachers, parents, unable to access the tests they desperately need. However, a number of them have also been advised that if they put an Aberdeen postcode into the system, they can get a test in Twickenham, and they have succeeded. So could the Secretary of State please tell me how on earth a world-beating test and trace system is functioning in this way? What is he doing to fix it? And in the meantime, does he recommend that I tell those constituents who desperately need a test to game the system in this way?
No, Mr. Speaker. In fact, it's incumbent on all of us to take a responsible approach and tell our constituents that tests are available in large numbers, that the average distance travelled is 5.8 miles, and that people should take this seriously and not game the system.
Mr. Speaker, I'm very grateful to the government for all that it's doing to fight COVID-19 and to keep the population safe. Could I please ask my right honourable friend if there is a formal trigger for easing the rule of six and measures like it?
Well, Mr. Speaker, my honourable friend makes an important point, and it comes to the previous point made about Christmas, because of course we'll keep the rule of six in place only as long as it is absolutely necessary for health reasons. And the vaccines and treatments that I spoke about, the mass testing regime, all of these are important to try to find a way through this virus with the minimal impact on the economy and education, of course, and people's social lives. There isn't a formal rate at which we'll make that review. We keep everything under control, and we constantly will no doubt debate it in this House in order to come to the right decision.
Thank you, Elliot.
Thank you, Mr. Speaker. Mr. Speaker, the Secretary of State is in danger of believing the figures, the global figures, without actually looking at the reality on the ground. Over the weekend, in my borough, which has been working hard with the government on an outbreak which we are working hard to keep down, we have 2 walk-in test centres. They've been advertised as such to reach the digitally divided and make sure that people can get the tests quickly. Over the weekend, staff from Deloitte's, a private company running this public service, told people they could no longer walk in. This was not communicated to the local authority, which was still being advertised as a walk-in, and over 90 people were turned away from 1 test centre alone. This is a fiasco that is of the government's making, and he could intervene now to make sure that at the very least there is communication. And I hope he will release the correspondence between Deloitte's and the Department for Health and Social Care so we can see exactly what's happened.
Well, I'll happily look at that individual case. Of course, there are many hundreds of tests being done in her constituency, as well as across London. I can look at the individual point and make sure that the communications occur as necessary.
We have 8 withdrawn, so we come to Sarah Owen. Sarah Owen.
Speaker, we've heard case after case of failure when it comes to testing. I've heard from parents, teachers, a vicar in Luton North, all saying there are no walk-in tests, no drive-through tests, no home kits available when they need it. The Secretary of State talks about capacity, but what we need to see is access to testing. Capacity is nothing without access to testing. When will people with symptoms expect to get tests when they need it, where they need it?
Well, the vast majority of people do, and in Luton yesterday, 484 people got tests. So I agree, actually, with the previous speaker on the other side. We should follow the data.
Mary Robinson.
Thank you, Mr. Speaker, and I congratulate the government on their efforts in increasing testing capacity and working with local authorities to do so. However, soaring COVID cases in Greater Manchester have meant that there are some people who are still and now unable to get the testing that they need. We know that children are back in schools now and that schools are natural incubators of colds and tummy bugs, which do mimic some of the COVID symptoms. As the flu season now starts running, will the government also look at the guidance that it is giving to schools and to people about how we could go access those tests?
Yes, absolutely, Mr. Speaker. Of course I'll do that. And we have put significantly more testing into Stockport and my honourable friend's constituency. 720 tests just yesterday. One of the reasons for that is because of the higher rates in Greater Manchester. The point she makes about schools is very important. Not just that, to get the capacity so that tests can be there for when there is a positive, somebody has the positive symptoms of coronavirus, but it's also incumbent on schools to send pupils for testing only when they have the symptoms of coronavirus, to make sure that we can prioritise that testing for the symptomatic people who really need it.
Chris Bryan.
I'm enormously grateful to the Secretary of State for the help that he provided over the weekend with Vaughan Gething and with the Minister as well, trying to get the mobile testing centre in Porth which is now moved to Clydach, fully functioning in the Rhondda, but not least because we have a very high number of infections at the moment, and we're just trying to work out what the specifics of that look like in terms of potentially a lockdown. But I do say to him that today, the best part of 60 people turned up for a test when they had made an appointment in Abercunnan, and they were told that there are no test kits. There might be some available this afternoon. They should come back and try again later on today. Still, people are being told to go to Aberdeen. I don't know whether it's just the alphabet. People think that Aberdeen is near Abercunnan, but it's a very long way away. And I would gently say to the Secretary of State, I know he knows there's a real problem here. Trying to rebut every argument with, honestly, we've got more people doing more stuff and people need to get with the programme and all of that. It just doesn't wash with the public. And there's a real danger that if he does too much of that, people will just say, well, we can't trust you anymore.
Well, what I'd say to the honourable gentleman is that he's right. We worked hard over the weekend and we're speaking over the weekend to ensure that we got those mobile testing units into the Rhondda. And there is a significant outbreak, and it shows actually the effectiveness of people working together to deliver solutions. And I absolutely acknowledge the challenge. I do, but I also urge everybody to ensure that the message gets through both to the people in the Rhondda and across the country that tests are available. And that's why I use these figures to demonstrate that hundreds of people in every constituency are getting tests, because I want people across the country not only to know that we understand that there's challenges and are working incredibly hard to fix them, but also to know that tests are available.
Caroline.
Thank you, Mr. Speaker. My disabled constituent Ian Kenny has been trying since the 8th of September to get a home test. He cannot drive, so can't go to one of the test centres. He has symptoms, but has been told there are no home tests available. Until such time as he can prove he does not have COVID, he cannot access the hydrotherapy he needs, and he cannot go back to work. What reassurance can my right honourable friend give Dr. Kenny that he will be able to get a test? And he speaks today of prioritisation and difficult choices, but disabled people living in their own homes must be a priority and must not be forgotten.
Absolutely, and listening to the case, I'll of course be happy to look into it in detail, but a case like that where there is a clinical need, those cases should be at the top of the prioritisation. And as we've set out in the past the prioritisation, we'll continue to update that to make sure that it matches the latest science. But she's absolutely got a point, and I'll make sure that is looked into in great detail.
Jim Chung.
Thank you, Mr. Speaker. The Minister, Secretary of State, is certainly a very busy person. Will the Secretary of State outline what steps have been taken in cooperation with the Department of Education to see school classes that have a positive case in their bubble are returned to school as a matter of urgency? The reason why I bring this to the Minister's attention is quite simply, one child in the household has a classmate who's at COVID-19. They are tested and are proved not to have it. They're sent home with their mother, but other children in the household in the same houses go to different classes in the school. It seems a bit absurd, doesn't it?
Well, if somebody tests negative in a school environment like that, then in the case that he gives, then of course the school can carry on as normal because there isn't a sign of COVID. I'll make sure that the guidelines around exactly that circumstance are, I'll double check that they're clear, and I'll speak to the Department for Education.
So Desmond Swain.
To what extent is there a possibility that it is the exponential increase in testing itself, in identifying genuine new cases, and the very significant possibility of false positives that is giving a distorted impression of the trajectory of the disease?
Well, I like my right honourable friend very much, and I wish it were true. The reason that we have the surveillance testing done by the Office for National Statistics is to ensure that we're constantly looking on a national representative sample at what the case rate is, as well as, of course, using the tests. And as we increase the testing numbers, inevitably we'll find more of the cases that are there. That ONS survey published on Friday does show a rise in the numbers, consummate with the rise in the numbers of tests that have come back positive, and that does take into account this point about false positives, which is a very important one.
Thank you very much, Mr. Speaker. There is work underway to set up a walk-through testing centre at Glasgow Caledonian University in my constituency. But with universities returning just now, what additional capacity is being put in place to deal with what could be an additional surge of tests needing processed?
We are working with universities to try to ensure that there's testing available as appropriate. It has to, of course, follow the wider prioritisation. But right across the UK, making sure that universities are ready for the return, including with testing where that's appropriate, is obviously a very important subject that we're working on right now.
We now come to Chris Growley.
Speaker, my constituents are also sharing the same experiences as the member of South West Surrey, so I really would encourage my right honourable friend to do everything he can on testing capacity. But can I ask him about the rule of six? If you are lucky or unlucky enough to have 4 very young children, under these rules, you're not actually allowed to meet another household at all. And I do hope that the government will keep these rules under careful review and to look at every way possible of making them as fair as possible for every family.
Yes, I do understand. I do understand the point that my right honourable friend is making, and we do understand the impact that these rules that we have to put in place have. It's the same around the world, that the rules needed to be put in place to deal with the pandemic are not pleasant ones or ones anybody would want to have enforced, but they are unfortunately necessary in order to save lives, and sadly we're seeing the consequences, including in some of our closest neighbours, of what happens if you don't take the action that's needed.
Rosie Duffy.
Mr. Speaker, whilst I'm sure that many ordinary people were thrilled to learn that the government's rule of 6 does not apply to so-called sports such as grouse shooting, where up to 29 people can mingle, expectant mothers in my constituency and across the country are unable to take their partners to crucial checks during pregnancy. Currently, individual health trusts are left to make decisions on this, leading to a postcode lottery. Isn't it time that the government stop passing the buck like they did to school leaders and instead provide national leadership across the country on matters as vital as maternity care?
Yeah. Well, I've a huge amount of sympathy with the case that the Honourable Lady makes, and in fact, last week we changed the guidance on this to allow for much more, for partners to go with pregnant women to these sorts of tests, and of course to the whole of the birth. My honourable friend, the minister responsible, the member for Mid Beds, is leading on this, and we've made some significant progress in the last week. I also commend the campaigners who are pushing so hard to make sure that each hospital follows that new guidance, and so that people can have a loving partner with them during those very special moments.
Stephen Crow.
Thank you, Mr. Speaker. On the rule of 6, I completely agree with my right honourable friend about the importance of clarity and simplicity, and we saw early on in the pandemic some of the problems that arise when you have different rules kicking in different parts of the United Kingdom. So on that point, is there not a really strong case for having one simple, understandable rule of 6 that applies right across the country, and actually one that has high levels of public support? And to that end, would I encourage him to keep an open mind about the rule of 6 that's in place in Wales and in Scotland, and the exemption of small children?
Well, I absolutely keep an open mind on all of these things. We constantly are looking at the evidence and the data and updating policy accordingly. We've made the decision on the basis that I explained. But I also, of course, I understand the other point of view. But the cause of simplicity was and clarity of explanation was the case that won the day.
Stephanie Peacock.
Thank you, Mr. Speaker. My constituent in Barnsley has been trying for 7 days to get a test for her teenage son after he was sent home from school with a temperature. She's been offered a test in Bolton, Edgbaston, Oldham, and nearly 400 miles away in Inverness. When will the Secretary of State stop denying there is a problem, apologise to my constituent, and sort out access to testing once and for all?
Mr. Speaker, if the Honourable Lady gets in contact with me with that individual case, there were 686 people in Barnsley who got tests yesterday, and I'm sure that we can ensure that her constituent gets that test.
James Wilde.
Mr. Speaker, as demand for testing increases, some of my constituents are struggling to get slots, having to travel significant distances, or even being turned away from mobile test centres. So can my right honourable friend confirm whether the government's plans to increase capacity are aiming for 10 million tests a day, or the 2 to 3 million that Sir John Bell talked about this morning? And as part of that very welcome boost, will you look carefully at my request for a public testing site in King's Lynn?
I'll absolutely look at his requests in King's Lynn. Thankfully, after an outbreak a couple of weeks ago, the numbers of positive test results in Norfolk have come right down. I commend the work of Norfolk County Council and my honourable friend and colleagues across Norfolk who've done so much work to ensure that the public messages get through. On the question, Mr. Speaker, of the moonshot, we haven't had any plans for 10 million tests a day. But we do have a goal to get to the millions of tests a day when we can. It's dependent on new technology. So that's what we need to drive forward. And it is absolutely vital for this country, for the resolution of exactly the problems that we're talking about today, but also to then expand testing availability more widely, that we really embrace those new technologies.
Van der Mishra.
Thank you, Mr. Speaker. Yesterday, I was contacted by an NHS nurse who had spent the weekend trying to get a test for a symptomatic 7-year-old, unsuccessfully. On Friday, I visited the new Brinnington Test Centre in my constituency. It was very quiet, yet seems to have been unable to offer a test to a nurse whom it seems will now need to take time off work. Mr. Speaker, is this what world beating looks like? What's going on?
Well, again, Mr. Speaker, I'm very happy to try to solve the individual issue around the nurse, not least because the figures that I read out for Stockport don't include the NHS capacity, which is there for NHS staff to resolve exactly the sort of issue that he talks about.
We now come to Paul Brister.
Cancer Research UK estimate that the backlog of people waiting for a screening due to COVID-19 might be as much as 3 million people. Will the Minister give an update on the work he is doing to ensure that all areas of the NHS are able to carry out screening programmes and the work he's doing to reassure people that it's safe to attend these screening tests?
Yes, this is an incredibly important subject to make sure that we get the screening available. And in fact, it ties into the questions on testing, because prioritising testing for those who are about to have NHS procedures, whether that's diagnostic like screening or whether it's an operation of some sort, that prioritisation is so important. For instance, to make sure that we tackle the backlog in cancer cases that inevitably built up. Now, that we are tackling that backlog. It's down by about half, and I'm very happy to work with my honourable friend and all others in this House to make sure that people get the early diagnosis of cancer, which can so often be life-saving.
We're now heading to Scotland with Dr. Lisa Cameron. Dr. Lisa Cameron.
Many thanks, Mr. Speaker. The Secretary of State will be aware of a recent survey that found 1/3 of children feel more anxious, sad and stressed now than before lockdown. The charity Action for Children has therefore asked the government to prioritise children's mental health in COVID-19 recovery, planning and provide adequate funding to meet this demand. So could he tell the House exactly what he's done about that and when we can expect him to announce a COVID recovery mental health strategy?
Thank you, Mr. Speaker. This is an incredibly important subject, and I commend the Honourable Lady for raising it and for her work on it. As with so many across the House, we are putting more funding into mental health and paediatric mental health in particular to make sure that we tackle this, the inevitable consequences of the pandemic.
Christian Wakeford.
Thank you, Mr. Speaker. Hands, face, space has been the public safety message for weeks now. However, I feel the public are not as safe as we could be. What thought is my right honourable friend given to ensure that face masks and hand sanitizer offer the fullest of protection by regulating the need to meet set safety criteria, whether that be the BSI standard or the WHO formula for hand sanitizer, to make sure that we are all as safe as possible using these mitigating factors?
Well, thank you, Mr. Speaker. We do have a standard for clinical masks, but for the widespread use of face coverings, we actually don't set a standard because the evidence is that for the general public, using a face covering can make such a big difference without drawing on the supply of PPE, of clinical masks. When it comes to hand sanitizer, there are standards actually set by the European Union that defines what you can put into a hand sanitizer. But I'm very happy to work with my honourable friend on the details and if that needs to be strengthened.
Rupert Hutt.
A world-beating app that's nowhere to be seen, national R8 rocketing, and local testing all but impossible. In Ealing, you'd be lucky to get Aberdeen. All bode ill for the start of the educational year. Can he, with press reports swelling around that there are hundreds of school outbreaks so soon in, tell us exactly how many of those there are? Can he up the number of kits there supplied from 10 apiece? And can he ensure that as universities go back, meaning that people are moving around the country with different bits of infection rates, ensure that everyone on campus gets to test, symptoms or not? Because we can't let education be the next care homes crisis.
Well, thank you, Mr. Speaker. The Honourable Lady raises important points. It is important that within her constituency, within Ealing, there were 462 people yesterday who got a test. So tests are available widely in Ealing. The other issues she raises around making sure that we have access to testing in schools and in universities is important within the prioritisation. And as she knows, we've sent tests to every school for use in exceptional circumstances when they need them. It's very important those tests are used when people are symptomatic rather than asymptomatic.
Anderson.
Thank you, Mr. Speaker. Last week, a mobile COVID testing centre set up in Ashfield, which helped hundreds of my constituents get a test. But there were several constituents over the weekend who said they struggled to book online due to the demand. Could my right honourable friend please advise the people of Ashfield what more can be done to ensure everyone in my constituency who needs a test gets a test?
Well, we have put in that extra capacity into Ashfield that he talks about. And I'm delighted that the number of people in Ashfield that are getting a test, therefore, has increased. And we've got to make sure that we get to the position where everybody who needs a test can get a test, making sure that we follow the prioritisation. I look forward to working with my honourable friend to fix the problem in Ashfield and across the country.
Charlotte Nettles.
Thank you, Mr. Speaker. In Warrington, we have seen spiking numbers with over 200 confirmed cases for the most recent weekly figures. Our rate is now the 6th highest in England. Wow. We have real issues with demand for testing far outstripping local capacity. So can the Secretary of State please outline what additional support he will give Warrington Borough Council to increase our testing capacity so that we don't have to go back into lockdown like our Greater Manchester neighbours?
Hear, hear. Yes, absolutely. She's quite right to raise the concerns in Warrington with the increase in numbers of people testing positive. And I'm very happy to work with her and the Warrington Council and my honourable friend, the member for Warrington South, to make sure that we get the best possible response, including putting in that extra testing.
Mr. Speaker, traditionally the start of the autumn term is the peak for returning school children showing signs of colds and sniffles, and I'm now increasingly getting reports from my constituency of young children being turned away or returned from nurseries and primary schools if they're displaying any cold symptoms. And I'm afraid I have to tell the Secretary of State that testing is not at a record high in my constituency because of a capacity being moved up north and to hotspots. And that's despite Worthing now being on the watch list because of a single outbreak of 23 people not abiding by the regulations. And I heard yesterday from a constituent referred from the Sussex coast all the way to Aberdeen. Can he not forget those very young children and the huge impact they can have on families and schools if testing is not properly available for them?
Well, yes, of course. It's so important in Worthing, as across the rest of the country, that we prioritise the testing that we've got. He's quite right that when schools go back, children often do get a cold, get non-coronavirus, a normal illness, if you like, a normal cold. And there's that is obviously contributing to the increase in demand, as well as people who are not eligible coming forward. That's one of the reasons we've been building capacity all throughout the summer. And I look forward to working with my honourable friend to make sure we solve the problems in Worthing.
Let's head to Manchester, to Denton Reddish with Andrew Gwynn. Andrew Gwynn.
Greater Manchester is a COVID hotspot. The nearest testing centres to me are Hyde, 1.5 miles, Ashton, 3 miles, Brinnington, 3 miles, Bellevue, 4 miles, Etihad Campus, 5 miles, Oldham, 9 miles, and Manchester Airport, 11 miles. There might be testing there, but local people can't get slots. Instead, too many of my constituents have been allocated Telford, a 152-mile round trip, Llandudno, 174 miles, Leicester, 216 miles, Glasgow, 450 miles, and Aberdeen, a 716-mile round trip. My constituents don't want to become super spreaders, so why is this world-beating system going so spectacularly wrong for them?
Thank you very much, Mr. Speaker. Well, we have put, as he says, as he outlined in his questions, an enormous amount of testing into Manchester. There's availability in Manchester because of the prioritisation of testing, because it's such an outbreak area, we put a huge quantity in. Of course, as I've said repeatedly, there are operational challenges, but thousands of people every day are being tested in Manchester in order to get a grip of the outbreak there.
Andrew Mitchell.
Mr. Speaker, my right honourable friend has my sympathy and support as he discharges his duties. He's well aware of the position across the West Midlands, and in particular in the royal town of Sutton Coldfield, where we do have testing difficulties. I'm very concerned to hear today that Leyhill Surgery has no less than 4 GPs who are having to self-isolate and cannot get a test. Can I make 2 points to him? First of all, can I join with those who want an exemption for informal childcare, so parents in certain circumstances can still go to work? And can I ask him to look at a system where all members of Parliament get access to regular infection rate details, both by local government wards and by postcodes?
Yes, I'm very grateful for the support from my right honourable friend. I'm working very closely with him and with the other Birmingham MPs, because there is a serious challenge in Birmingham and other parts of the West Midlands. On the point about getting the data down to a ward level, I will absolutely ensure that he gets that data. We looked at it down to a lower super output area level, and in fact we publish that data weekly. I'll ensure that it gets to him and we get the full details of exactly how many cases there are in each part of Birmingham, because I know that Sutton Coldfield is, whilst it's in the Birmingham local authority area, it is a distinct geography within that area, and I recognise that. And as he knows both from our discussions and from how we've acted in other parts of the country, we will take action on a sub-local authority area where that is supported by the data. Unfortunately, for now, we do have to have the local action in Sutton, but we keep that constantly under review.
Thank you, Mr. Speaker. Has he seen today's analysis revealing the terrifying scale of the backlog in cancer treatment and diagnostics? It is now clear that it would take the system operating at 135% capacity for 6 whole months just to catch up with where we were in March. Until then, the tragic reality is that people in my constituency and around the country will unnecessarily be losing their lives. So I beg him to urgently meet with the clinician-led Catch Up with Cancer campaign so that we can give him the solutions to boost cancer services and save tens of thousands of lives.
Yes, I'm very happy to meet with the campaign. Of course, I've seen the reports. I feel very strongly about this. We have worked very hard to get through the backlog, and we are making progress against that backlog. But nevertheless, anything we can do to speed that up, I'm happy to look at, and so look forward to listening to the details of what we can do.
Robertson.
Thank you, Mr. Speaker. As my right honourable friend knows, sporting venues are suffering financially because of the restrictions, and it doesn't help when planned pilot events are cancelled at the last minute. Could you tell me who takes the decisions on whether to allow pilot events to carry on or not? Is it taken centrally or locally, or a combination of both? Because there is a feeling that there's some confusion.
Well, my colleague, the Culture Secretary, is responsible for the programme of pilot events. Of course, for a pilot event to go ahead, it both needs the support of the local council and to be advised as COVID secure by Public Health England. So DCMS take the lead. Of course, I understand the impact. As the MP for Newmarket, one of the 4 towns in my constituency relies on sports for the livelihoods of thousands and thousands of my constituents. So of course I understand that impact in exactly the same way as the MP for Cheltenham Racecourse that my honourable friend does. I speak a lot to the Culture Secretary and the Prime Minister about this subject, and I hope we can get as much going as fast as possible, but safely.
Steve McCabe.
Mr. Speaker, I understand it isn't dead easy, but rather than come here and give us big numbers about the number of tests completed or the average journey travelled, why doesn't the Secretary of State listen to what people on all sides of this House are telling him today? Why doesn't he try to understand what it's like to be a parent in Special Measures Birmingham who's directed to Oldham for a test when there's a walk-in centre 2 miles down the road virtually empty? Will he just recognise that there is a problem, and will he tell us what he's going to try and do to put it right?
Yes, Mr. Speaker, I absolutely recognise that there are challenges here, and I set them out in my initial answer and repeatedly. I just urge colleagues on all sides of the House and the honourable gentleman, who I have huge respect for, that also we are only going to solve these problems if we use the data as our guide.
Thank you, Mr. Speaker. I have constituents in Scunthorpe who have struggled to access a face-to-face GP appointment. Can my right honourable friend reassure those constituents that should they need one, they'll be able to have one? Thank you.
Yes, there is no greater supporter than me for the ability to access medicine by telemedicine. It's an incredibly important option that's available and should be a choice for our constituents. And we have made the access by telemedicine as the default method, unless there's a good clinical reason not to. It is, however, as I've always set out, critical that there is face-to-face access as well. And so the NHS has written to all GPs to explain that whilst telemedicine should always be available, and that option should be available where it's clinically right, also face-to-face appointments should always be available and are absolutely necessary. It's the combination of the two that is the future of the NHS.
John Speller.
Mr. Speaker, people in Sandwell and Birmingham certainly want to know why their whole boroughs are being suddenly locked down and not just the currently affected areas within them. But they also need a plan as to how we are going to contain the virus without paralysing society and the economy, as we may have to coexist for years with the virus, as countless societies and countries have had to live with many awful diseases over millennia and even now today. So when are we going to transit from reactive risk avoidance to prudent risk management?
We absolutely need to control this virus. I very much hope that we will have very significant progress through treatments and vaccines within the sorts of times I've set out before. Definitely within, definitely not a millennium. I think, Mr. Speaker, we will make significant progress in the coming months. However, in that time, we do have to control the virus. We took the action in Sandwell, having looked carefully at the data, working with his local authority, and we looked carefully at whether we should only put some parts of Sandwell in particular. Earlier on, the Smethwick area was much more significantly affected. However, it was clear that the virus was spreading throughout Sandwell, and so we took the decision, working with the local authority, to take local action across the whole district. So that is the sort of action that we have to take. The strategy that I've set out many times at this dispatch box, Mr. Speaker, is that social distancing is the first line of defence, the rule of 6, hands, face and space. The next line of defence is testing and tracing. That's why it's so important that we have record capacity in testing, and obviously we're trying to boost it further. And the next line of defence is local action, and we do take that local action where it's necessary, even though it's uncomfortable to do so.
Richard Holden.
Mr. Speaker, can I thank the Secretary of State for his visit to Shotley Bridge in my constituency yesterday. I look forward to him working on the campaign for a new community hospital in the coming months. Can I also welcome the massive increase in testing, including the mobile testing unit, which has been in concert AFC over the last few days. But one of the things we are seeing across the North East more broadly is an uptick in the virus. I know the Secretary of State has now had meetings with various North East councils on this, and can I encourage him to give powers to the local authorities that they need to enable targeted local action in the North East if necessary?
Well, Mr. Speaker, it was a real pleasure to be in Shotley Bridge yesterday and to meet my honourable friend there, and also to visit Shotley Bridge Hospital. And as he knows, as well as the whole House, we will build 40 new hospitals. And so it was very interesting to see the plans that were put in place. I will I will absolutely take away his point about the rise in the cases in the North East. The 7 North East councils have written to me with a proposal for how we should tackle the increase in cases there. And I've been studying that proposal and will make an announcement as soon, Mr. Speaker, as a decision has been taken.
Newland.
Thank you very much, Mr. Speaker. Given what we've heard so far about people in England registering as coming from Aberdeen and perhaps other places, is he not concerned, as I am, that this may completely undermine the data and any resultant decisions taken to act on and manage what might appear to be a Scottish outbreak?
Obviously, I talked to the Scottish Government, who are responsible for local action in Scotland, and we work as closely as we can to try to bring both the UK capacity to bear and the local capacity. We have put much more testing into Aberdeen, which is right, and I support the Scottish Government in the action that it takes in order to bring the cases down there.
Scott Mann.
Thank you, Mr. Speaker. Can I congratulate the Secretary of State on the biggest testing regime in this nation's history? 20 million tests is a monumental feat. However, that being said, it would be wrong for me not to highlight the calls that we've received into my office at the tail end of last week and yesterday with people in Cornwall unable to access a test. So can I ask him what progress he's making in expanding the number of tests in Cornwall so that my constituents can get access to them?
Yes, there is over 600 tests a day in the last couple of days in Cornwall. So people in Cornwall can access tests, and it's very important if they have symptoms that they continue to do so. But I, of course, acknowledge the challenges that have been faced as well. And we want to increase capacity for testing right across the board. I'm really pleased to say, Mr. Speaker, sometimes we have to discuss difficult issues in this House, but I'm really pleased to say, especially with so many people having gone to Cornwall over the summer, because it's such a wonderful place to have a summer holiday, as I can personally attest, that the case rate in Cornwall has stayed really low since then. And I pay tribute to everyone in Cornwall for the work that they're doing on social distancing, on hands, face and space, and being cautious and careful to stop the spread of this virus. And let's hope that it remains so.
Ursula.
Thank you, Mr. Speaker. There are 3 testing centres in Coventry, but constituents have told me of their distress and their despair that they can't access a test. Some can't book a test anywhere, while others have booked only to be turned away at the centres, and there are cases of people in Coventry being directed as far away as Inverness. The government has had 6 months to get testing sorted, but this is a complete, utter farce, and the Secretary of State, quoting figures, isn't good enough. So when will this mess be fixed, and when will my constituents be able to access the tests that they need?
Thank you very much, Mr. Speaker. Well, of course, as she well knows, we're working to both increase capacity and ensure that we have prioritisation so that the people who need the test most can get access to those tests. I'm sure she'll agree with me that it is very important both to listen to voices and to the stories of those people who have had difficult experiences, but also to make sure that we look at the facts on the ground. There were 762 people yesterday who got a test in Coventry. That's an increase over the last week. I'm really pleased that we're able to get hundreds of tests a day in Coventry, but I also appreciate that we need to keep expanding capacity.
Andrew Simon.
I'm really keen that we proceed on the basis of reliable and agreed evidence. So what would the Secretary of State say to people who point to Sweden as an example of how we can control the virus and minimise the impact on the economy and our social lives?
Well, I've looked very closely at the situation in Sweden. The challenge is that in Sweden they did bring in significant laws curtailing social activity, and also the population of Sweden followed a lot of guidance that wasn't enforced by law more closely than has been the case in almost any other country in the world. The case rate in Sweden was higher than other geographically comparable countries. The conclusion I've come to is the approach that we're taking here, where we learn from similar countries and we look around the world and we take action where that's necessary, is the best way to both control the virus and to protect the economy. because the design of the rule of six is to try to restrict the transmission where we see it happening most, which is in social circumstances, and protect the economy as much as is possible by keeping the economy open within those social constraints. So it's something that we're constantly vigilant to and looking at around the world for other examples where we might be able to make changes. And as he knows, we've made changes to our approach as we've learned throughout this unprecedented pandemic.
We're going up to Ealing North with James Murray. James Murray.
Mr. Speaker, my constituent Rachel has an 11-year-old daughter who came down with COVID symptoms on Sunday. Her family have spent days all self-isolating, desperately trying to book a test, and they were at one point directed to Wales, which is a 6-hour round trip. At the same time, Rachel has seen private tests for at least £140 and often much more that seem to be easily available. Does the Health Secretary think this disparity is acceptable?
We don't recommend any private tests that are not signed off and verified, therefore we're providing tests in as many tests as we possibly can with a growing capacity. If he writes to me with the details of the individual case, I will absolutely look into it and make sure that one of the hundreds of tests a day that are being done in Ealing is available for his constituent.
Thank you, Mr. Speaker. Having raised the issue of testing capacity in Buckinghamshire last week, I'm enormously grateful to my right honourable friend for the supply of 2 mobile testing units in the town of Buckingham and neighbouring Aylesbury this week. But like many honourable and right honourable members, I also continue to receive a lot of emails every day from constituents unable to access testing. So can my right honourable friend update the House on progress for a permanent uplift in that capacity for Buckinghamshire residents?
Yes, of course. So he's right to raise the issue. We have put more testing into Buckingham. There are hundreds of tests available across Buckinghamshire for his constituents and others. And we are working hard to ensure that the overall capacity is increased as well, because in this debate where our constituents understandably want to get access to a test whenever they want one, I understand that yearning. We have to prioritise and put, as I said in my opening answer, we have to put NHS needs and social care needs at the top of the list. And I make no bones about that prioritisation. But we also, at the same time, need to get the overall capacity up, which is what we're working incredibly hard to do.
Thomas.
Thank you, Mr. Speaker. Like elsewhere, the numbers with COVID in Harrow are on the rise. And whilst there are tests available for key workers, I'm told that parents and their children cannot get a COVID test for, quote, love nor money in Harrow or indeed near Harrow. I say gently to the Secretary of State, that doesn't feel like a world-leading test and trace system yet at the moment. And so would he take a specific look at Harrow and the circumstances there in terms of testing, and in particular, why the nearby test centre at Heathrow is so unused at the moment?
Well, the honourable gentleman makes an important case for Harrow, and I'm very happy to take a look at Harrow specifically. The capacity constraint that there is in the labs rather than the centres. We have the centres available to be able to process a huge amount of tests. We have the record capacity in the labs, but it is in the labs that the constraint is. Now we're bringing in more machines. We've got more being installed all of the time. That's why the capacity is constantly going up. But nevertheless, clearly we need to keep driving at that because the demand is going up as well.
Jeremy.
Thank you, Mr. Speaker. We need to use every tool at our disposal to stop the spread of coronavirus. And I welcome the news that the NHS Contact Trace app will be available by the end of the month. And I welcome the news that it's available throughout England and Wales. Will my right honourable friend join me in urging businesses in Bridgend to get prepared with the NHS QR code scan poster?
Yes, the NHS COVID-19 app, which will be available this month, has one of its features as making sure that you can go through the you can go to the pub, you can go to a restaurant, you can go to a hospitality venue, and you can scan the QR code quickly, and that means your contact details are then safely collected in case they are needed for contact tracing purposes. And we're making that scheme mandatory. It's been very successful voluntarily, and we're going to roll it out mandatorily. And so therefore I'd urge businesses, hospitality businesses, in Bridgend and right across England and Wales to download a QR code for themselves, to put it somewhere where it's very easy to use and obvious, so that all of us, when we go to the pub in Bridgend or anywhere else, can very easily scan in, and then if there is an outbreak, we can contact trace that outbreak and we can keep the virus under control.
Debbie Abrahams.
Thank you so much, Mr. Speaker. I don't underestimate the challenges that the Health Secretary has faced over the last few months. But 6 months on, after many, many warnings of what would happen and the likelihood of a second wave, without a fully operational test, track and isolate system in place before lifting the lockdown, unfortunately the government is still not getting the basics right. And that's happening in my own constituency. In Oldham, we didn't have a mobile testing unit turn up. We're still not getting the data that we need to trace COVID positive cases. So, as for starters, will the Secretary of State sort out the private contractors for the national test and tracing system? Make sure directors of public health are getting timely, high quality data of COVID cases, including occupational workplace details, and fundamentally, make sure our local authorities have the resources they need to trace all contacts and ensure restrictions are understood and observed. Thank you so much.
Yes, the answer is yes. In Oldham in particular, where there's been a really very serious outbreak, making sure that we have that connection between the national system and the data flowing through to local contact tracers is incredibly important. And we're working on some innovative solutions that have been proposed by the local authority and others in Manchester to enhance that system as much as we possibly can to keep control of the virus.
Steve Bryan.
Lots of my constituents in Winchester have had tests, and the government deserves credit for that, because we as a country started from a position where we just did not have a system. And the Health Secretary had to create it from scratch, and he's had great help in that from the private sector, which we certainly shouldn't be denigrating. We should be thanking, and we should be expanding the help. I wonder whether, with the operational challenges the Secretary of State talked about, whether GP surgeries, even our wonderful community pharmacists, could be part of the solution in the front door testing. And I wonder, what is the cross-government superhuman effort part 2? AstraZeneca were very helpful in part 1. What is the superhuman effort that's going on to increase this lab capacity, which seems to be the challenge, as outlined by my right honourable friend today?
Yes, well, we are increasing that capacity, and we're bringing new technologies to bear in those labs to expand that capacity. But my honourable friend is a great expert in this, Mr. Speaker, and has a really important point, which is that whilst the current technology works best in labs, and you have to send the swab off to the lab and get the result back, and there's a huge amount of logistics around that, getting to the technologies that can be there in a pharmacy, in a GP service, and you can get the test result back straight away. That technology, when it comes on stream, and I'm optimistic about it, I'm optimistic about a lot of things, Mr. Speaker. I don't think I could do this job at the moment without being. That will give us a chance to really get the testing right out into the community at every level. And then the sorts of challenges that we have, that I know you have in Chorley, Mr. Speaker, and you brought to my attention quite rightly in your role as a local MP, as we all are, so that we can tackle those problems not by having a big national system, but by having the solutions deeply embedded in the community. And when we have the technology to do that, then we'll be in a stronger place, and we're putting every possible effort and support behind people to try to make that happen.
Please, you bring me back into it. Just to say, we've still got the lab at Chorley Hospital you can use if you get onto them. Where's Streeting?
Thank you, Mr. Speaker. We've had a real spike in cases in Redbridge, and yet in recent days, the Mildmay Road walk-in centre closed, for walk-in appointments without notifying the council or either of Ilford's MPs. People have been struggling to get access to tests. I've got a local secondary school that says it will close within 2 weeks unless staff can get access to tests. And the local walk-in centre won't even share testing data, which the Secretary of State says is so important, with public health at the local council. It's an utter shambles. Can the Secretary of State give us some reassurance he will help us get a grip in Redbridge, but also recognise from the voices we've heard across the chamber today, these aren't just problems in Ilford, they're problems right across the country, and the only way in which this system is world-beating is through world-beating incompetence. When will he get a grip?
Well, absolutely. I'm very happy to look at the specific issues that he raises in Ilford. Actually, we have an extremely good working relationship with the London group, cross-party, and including the health professionals. And so I'm very happy to take that point offline and work on a solution specifically in Ilford with him. As he knows, the good thing is nationally we are seeing that increase in overall capacity, but because of the increase in demand, we are having to prioritise. Having said that, in Ilford, I want to make sure that, like everywhere, we can have access for tests for the people who need them, and that is the job day and night.
Heading up to Rutland with Alicia Kearns. Alicia Kearns.
Thank you, Mr. Speaker. Pregnancy can be one of the most surprising, exciting, but also traumatic experiences of a woman's life. That's why this week I launched a campaign with the Mail on Sunday calling for all NHS trusts to ensure that partners support pregnant women at all scans and all stages of labour. So please can my right honourable friend confirm that women across this country have the government support and that he will push NHS trusts to stand by pregnant women?
Yes, Mr. Speaker, 100%. I strongly support my honourable friend, and I congratulate her on. Well, I know that. Well, I hope somebody says her pregnancy. I hope that it's public knowledge. Well, it is now. I congratulate her on her pregnancy, and so I know that she has a very strong interest in us getting this sorted. We did put out the extra guidance last week. It's been a pleasure to work with her on the campaign to make sure that all hospitals can follow that new guidance and make sure that partners can be there throughout each stage of pregnancy in a COVID-secure way, and that people can get the support that they need.
Daisy Cooper.
Thank you, Mr. Speaker. Coronavirus cases are on the rise in Hertfordshire, and yet in St Albans there are key workers, teachers, doctors, parents who cannot access tests, and they're frustrated for two reasons. One, because they can't get the test, but secondly, because this was utterly predictable. We knew there would be a surge in symptomatic cases, and we knew there'd be a surge in demand from key workers. So was any modelling actually done? And if so, will he publish it?
Yeah. Well, of course, we've been increasing that capacity all the time and working throughout the summer to do that, to make sure that there's as much capacity as there is. And the big change in capacity is going to come when one of the new technologies comes off. Mr. Speaker, that's why I'm so passionate about them, because that is what is going to be able to get us out of the situation of having to have prioritisation and instead getting a test to everybody who wants one, not just those who need them according to the clinical prioritisation.
Final question, Jason McCartney.
Thank you, Mr. Speaker. A local high school student was tested positive for COVID late last week. So when parents had children from the school over the weekend displaying symptoms, they quite rightly tried to book a test, but none were available on the portal.